Thank you all for having me. I love being here, and this is an important message. So again, my name is Susan Veldey, and I'm just going to be talking about emergency versus urgency and understanding what your options are. And I do have a bit of a unique perspective. When I first started working at Eisenhower almost 22 years ago, I was the manager of the immediate care in La Quinta. I did that for 5 years, and then I moved on to the emergency room. So I have that unique perspective of seeing both sides of the story. Now that I'm working in an inpatient nursing unit capacity, it is still very near and dear to my heart because we need to get the care we need to have. So we will go and begin. Emergency versus urgency. So at Eisenhower, we are committed to providing the best care that we can give you. That is 24 hours a day, 7 days a week, 365 days a year. If you feel that you're having an emergency, we do not want you to put off seeking any medical care. And that's really important. You know, a lot of times we think, it's not so bad. Maybe it'll be better tomorrow, but it can also be worse. So we want to get you the care that you need. So when you start having a medical problem, it's hard to know, is this something that can wait? Should I go in right away? Is it just something I need to get done? So just taking that minute before you decide to get help can help you actually get seen faster, get better quicker, and be more efficient for everybody. So is it urgent or is it emergent? So what is the difference? So an urgent care is kind of a step between your primary care doctor and the emergency room. So our urgent cares provide medical treatment that require immediate attention, but they're not life-threatening in any way. You don't need an appointment for an urgent care. Most of them are open 7 days a week, although their hours are limited. And again, generally an emergency is something that is threatening to your life, limb, or can cause permanent damage. So it always is important to stop and take a moment to think about that. Okay, urgent cares, they are staffed with physicians, nurse practitioners, RNs, LVNs. They're quick, they're convenient, and again, no appointment needed. So for those minor acute illnesses, so I have a sore throat, I have an earache, those things are not life-threatening, but again, you want to get them taken care of as quickly as you can. If you can't see your primary care or you don't have a doctor, you're visiting here from out of town, again, an urgent care is a really good option and no appointments needed. All right, when should you go to the urgent care? Like I talked about, cough, cold, sore throat, think you have the flu, strain, minor lacerations where the bleeding is controlled, insect bites, we even do school physicals and routine vaccinations there. So it's, again, that really nice option. All right, most urgent cares provide a lot of services. So they can do a urine analysis, a strep throat screening, check your glucose, pregnancy testing. We do COVID testing and RSV. We can also do HIV testing. And again, most urgent cares do have radiology. So if you think you have a broken bone, we can get an x-ray, and that's all done right there. Any other tests that you may need, we may not be able to run them at the urgent care, but they can still collect the blood or those kinds of things and send them to the lab. And again, those can be available in my chart pretty much the next day. But the important thing is we've got things going. All right, another great feature about the urgent care is that the documentation system is integrated with the hospital. So with your authorization, we can access that information. And again, that helps everybody give you the best care possible. So if you do end up coming into the hospital, your physician says, oh, what did they do at the urgent care? We can go into your chart and take a look at that. So it's very convenient and it helps the doctor care for you better. Again, as we had said, we have at least one physician on board, usually a nurse practitioner or a physician assistant. They all are very experienced in urgent care medicine. They will work very closely with your primary care physician, and they can also, if you need to get into a specialist, they work very closely with all the physicians on staff, so we can help facilitate that and make those arrangements as well. Again, registered nurses, LVNs, registration, all those people are there, just like I are in the hospital, to help take care of you and whatever it is you need. Okay, with the emergency room, again, call 911 or go to the nearest emergency department for life-threatening conditions. Okay, what is life-threatening? Again, chest pain, chest discomfort. If you think you're having a heart attack, guess what? If you're not, that's when we love being wrong. But the important part is you're having chest pain, you need to get in. Time is muscle. In those instances, you should dial 911. That is not the time for you or your loved one to be driving to the hospital. You can get worse on the way there. Everybody's excited, nervous. We don't want to have any problems in the car. In the Coachella Valley here, when you dial 911, help is less than 5 minutes away. When the paramedics get to your home, they have specialized training and they have specialized equipment that we can already start diagnosing and helping you. Another great feature about dialing 911 and having the paramedics there, if you are having a heart attack, they can call ahead to the emergency room and we can have the cardiologist, we can have everybody ready and waiting for you to arrive. Again, time is muscle and it's very important to get there as soon as you can. Shortness of breath, palpitations, stroke-like symptoms. So what is that? Stroke-like symptoms, we like to use the acronym B FAST. All right, what does that mean? B is for balance. If all of a sudden you have a loss of balance and you can't figure out why, that could be a warning sign. Eyes, are you having any difficulty seeing? Have you suddenly lost vision in one eye? Again, those can really be warning signs and you need to get help right away. Face. When you smile, is your face even? Is one side droopy or weak? Check out your arms. Hold your arms out in front of you. Are they even or is one weaker and drifting down? Speech. Any difficulty speaking? Any slurred speech? And T, the last of the B FAST, is time. This is a 911 call. Time is not only muscle, but time is brain. And it's really, really important. It's very time sensitive that we can give you the life-saving medicines that you need. Okay, so again, when should you go? Loss of consciousness, severe abdominal pain, fever in young infants. And we consider that less than 6 months. Any poisoning overdose, heavy or uncontrolled bleeding, head injury, major burns. Again, can't stress it enough. Time is muscle. You're having chest pain, that is a 911 call. Okay, time is also brain. And just again, like we talked about, be fast. Stroke-like symptoms, always think, I've got to be fast. And again, time is brain. All right, so what happens when you go to the emergency room? All right, when you get there, a nurse is going to greet you and she's going to ask you what's going on. This is called triage. Appropriate, the nurses will already start taking care of you at that time. If you are having chest pain, we'll do an EKG, we'll draw labs, and the physician will come to see you right away. With stroke-like symptoms, again, this is very, very time sensitive. They will take you to the back and they'll already start an examination for a stroke. Possibly a CT scan, all those things. And the nurses and the doctors are very well trained in this. Information, and this is always good to have, whether you're going to the emergency room, the urgent care, or your regular physician's office. Always have a current list of medications that you take and include the vitamins, because vitamins can sometimes make certain medicines work in a different way as they were intended. When the symptoms start or how the injury happened, any underlying health conditions that you might have, any allergies to any medications or foods. And again, if you have a primary care physician or you're seeing a specialist for any reason, that information is good for the doctors to know as well. So if they need to reach out, they know who we're trying to talk to. All right, in times of COVID-19, things have changed a little bit, but your health is still our #1 priority. So when you go to the emergency room or when you go to the urgent care, as much as your family loves you and they're worried about you, we'd prefer that not all your family come with you, just one person. Same with little children as well. It's just better not to have them exposed to anybody else. So that's kind of that. All right, so that is all of the information I had right now. I want to really appreciate you joining me this afternoon. If you have any questions, obviously we're going to have a Q&A here, but you can always call the urgent care or the emergency department because we are all here just for you. All right, here is locations of our urgent cares. We have them all throughout the valley, Palm Springs to La Quinta. And again, our urgent care hours are a little more limited. The Tennessee Emergency Department, again, we're open 24/7, 7 days a week, 365 days, and that's here attached to Eisenhower Health. All right.
All right. Thank you, Susan.
Mm-hmm.
What we'll do, give me 1 sec here, folks. We will. Susan, if you would like to unshare your screen.
Unshare?
Yeah, that would be great. And so what we're going to do now, there we go.
Okay.
Good to see everybody. And then if you
All
feel
right.
like you want to turn on gallery, feel free, folks. But let's have a robust conversation in regards to urgency. Give some examples, that kind of thing. So one thing, having been in both scenarios, both by ambulance to the emergency room, and then also myself personally for other things to urgent care or seeing in the lobby, I always see a lot of people waiting in the lobbies in both locations. Can you address just the safety protocols, things of why that takes place? And it's not just related to just Eisenhower, it's any medical facility and any urgent care in any hospital setting. but we see that a lot, and I just want to make sure people understand why that takes place.
Okay, actually, that's an excellent question. So we do have people waiting. Again, sometimes people bring family members or friends with them. And a lot of times it's just sheer volume. We see over 80,000 patients in our emergency department a year. And there's absolutely no way to predict who's going to be coming at one time. We do not have appointments in the emergency department. Now, as I talked about in the lecture, we have triage. Okay, triage is a French word and it means to sort. So what these emergency room nurses have, we have special training, and they recognize signs, symptoms, what things can possibly be going on. And the sickest patients always go back first, always. Because again, time can be muscle, time can be brain, and we need to intervene as quickly as we can. So as frustrating as it can be to wait, if you're not being rushed back, in retrospect, that's really a good thing, because no one has to intervene immediately to save your life. Also, what people don't see in the waiting room is in the back of the emergency department, we're getting ambulances. And again, we can't predict who's coming in. We don't pick and choose. They just come. So it's not unusual to have multiple ambulances coming in the back while we also have people coming in the front. And again, so everybody's triage and the sickest are always seen first.
Great question, or great answer. Not the question. But the other thing too, maybe you could speak a little bit about why someone would choose. In many cases, I hear from our community members when they say, "Oh, I have maybe some of these symptoms going on. It probably warrants a 911, but I'm going to drive myself, or I'm going to have a family member drive me." Why is that not advisable versus an ambulance pickup and delivery, do you think?
Again, an excellent question. So, as I kind of stated, paramedics have specialty emergency training, and they are already looking for signs and symptoms of things. They have specialty equipment in their ambulance, so they can already start caring for you before you even get to the hospital. When you decide that, oh, I don't want to make a big deal out of it, because that's what I hear all the time. Oh, well, I didn't want to make a big deal. I don't want the neighbors to know what's going on, those types of things. So you take that chance, either you drive yourself. Unfortunately, we have had patients trying to drive themselves to the emergency room. They decompensate or they get worse on the way, and other terrible things happen where there's an accident or they pass out behind the wheel, whatever it is. And I've also, unfortunately, in my ER career, have had to run out to a car and pull someone's loved one out of the passenger seat and start treating them right in the parking lot because they got worse and they just didn't make it to the hospital in time. And we want to avoid that at all costs,
Great. Couple questions that have come in the chat, and then we'll open up for additional.
Okay.
What ways would you recommend, and in parents, phone, bracelet, etc., to help ER get your health info if you're unconscious?
Again, the medical alert bracelets, they are great. I have used them on more than one occasion. You have your medical history and you just dial the number, and that is wonderful. The name has probably changed, but when we first started realizing how important medical information was to pass on, they used to have the vial of life. It was a sticker you put on your fridge, and they'd open the fridge and take out the vial, and all your stuff is there. Loved ones at home, again, you have everything typed out or written out and put in a place where you can say, hey, here's a list of his medicines, just hand it to the paramedics on the way. Having that information handy is so important. And like I said, it really could be life-saving.
And in regards to the phone piece, and just I just did this last week for someone at the gym who needed and asked me to use his smartphone, could not open it himself, and said, I need to phone my emergency contact. The problem being is that with a smartphone, it does, even though you don't have the password, you are able to get the emergency if you have set it up. If you set up the emergency contact, any one of us could go onto the phone. We can't access your data or anything else, but we can access the emergency piece and it pulls up. I did that for this gentleman. Unfortunately, he actually hadn't set up anyone in his emergency contact. So therefore I could access it, but there was still nothing in which to call. So that is one thing to do for the phone piece that someone was asking.
Mm-hmm.
And then another question, what should a person do if he or she has an urgent care type issue that needs immediate attention, but the urgent care is closed for the day?
Well, and it's the same thing. You can certainly come to the emergency room, but just be prepared that since it is not life-threatening, you may end up waiting a little while. And, we ask for everybody's patience with that. You will be seen. We won't ever turn anybody away, but it may be a little bit of a wait.
Yeah. Another question, thank you. It says, does it have to be a compound fracture to go to the emergency department?
Well, no, it does not. Again, if you twist your ankle, roll your ankle, hurt your arm, whatever it is, you can still be seen at the urgent care. If it's open, they can already do x-rays, they can already splint it and then get you to the specialty, to the orthopedic doctor that you need to see. Again, if the urgent care is closed or whatever the issue is, you certainly can go to the emergency room as well. Compound fractures, that's when the bone is actually sticking through the skin. That is a limb-threatening emergency, and that is definitely is appropriate to go to the emergency room and not the urgent care.
Right. Another one, and this goes to COVID and your comment earlier about COVID symptoms. What specific COVID symptoms should be present for a person to choose between emergency room versus urgent care?
Well, I'll tell you, it's actually very interesting that you bring that up because 2 years ago, COVID symptoms were very clear cut. You had a cough, you had a fever, you probably had COVID. Now, with more people vaccinated and with the different variants that we've had, there really is no clear cut anything. I've had patients and employees, gosh, I really have a sore throat today. Okay, I need you to go home. I need you to get, those kinds of things. They come back COVID positive. Some people are COVID positive. They hardly have any symptoms at all. So it's nowadays it's a little more difficult, but long story short, if you're sick, you take care of it. And, whether you go see the primary care doctor or you go to the urgent care, or you call up the COVID tent and say you need to be swabbed. It's difficult to tell now.
Got it. Thank you. All right, those are the questions in the chat, but I'm sure our audience might have some live questions. Feel free to be respectful, just unmute yourself and ask a question of Susan.
I do have a question. And besides Susan, the reasons and the presentation that you have given us to determine to choose between ER or UC, and without going into details, but if somebody is trying to make this decision based on cost, is there a difference that is important to understand? Like I said, without going into details, but is there a difference in cost for people, even if you have health insurance?
And again, I am no expert on the cost because I'm the nurse, and, even though hopefully my boss isn't listening, I don't care about that because my job is to take care of patients. But when you go, my educated guess is that urgent care is a little more cost effective just because in the emergency room, we need to be prepared for everything. So we have all kinds of specialized equipment. We have specially trained emergency physicians and nurses. And in the urgent care, you don't have quite access to all of that because, again, they're not set up for every possible emergent situation. But the great thing about the urgent care is when you're evaluated by the physician staff there, if they feel it is something more than they can manage, they will definitely send you to that higher level of care in the emergency room.
Thank you.
Great. Another question came in, and I know you'll have an answer, but if not, I have someone. How can the ER or urgent care access my chart?
Okay, same kind of thing with our electronic documentation system. We have Epic, and both systems are connected, so the provider can access, as well as you can access your chart with your permission, obviously.
Yeah, and I think the variable on that is if you're an Eisenhower person and you've already been to see us and you're in my chart, or you're with Desert AIDS Project, or a multitude of other medical facilities in state and out of state. And if they have my chart, and they may have a slightly different name on that, but it's Epic, then you'll have connectivity and you can share information, you can share x-rays, all kinds of stuff. Caveat to that is if you're at the VA and you're doing something, possibly Kaiser. I can't speak specifically on Kaiser, but they have their own network within that. They may be connected to my chart, but I know the VA is not as simple as that. So there's additional processes. So if you are trying to send information or documentation between facilities, we would not necessarily have immediate access to some of that, depending on what your setup is for your medical insurance and your own data. Is that correct, Susan? I believe.
Yeah. Correct.
Yeah. So, I said these are what we're talking about here. In most cases, are things are unplanned. If you're planning an illness and those kind of things, and you're seeing it coming, and it's not emergency or urgent, then yes, you're going to see your primary care. You're going to be in contact with them, and you'll have a little more time to be able to share that documentation as needed. All right, more questions. These are great. Let's keep it going. I'll ask one more while we're waiting for anyone to unmute. Is out-of-state visitors, or out-of-country visitors for that matter, are Canadians. If we have anyone on the call, we usually have a lot. How does that work in the sense basically Kaiser patients, out-of-state, anybody like that, they're urgent care or emergency, they're treated the same, correct?
That is exactly correct, yes.
Yeah, so there's no barrier to care. And I would say that's the same in most urgent care, but definitely in the hospital setting. If you're with Eisenhower or one of our other hospitals in the Valley, you will always be seen. But you just need to obviously do your due diligence about all the additional things that we just talked about.
Yeah, and I think one of the biggest that I really want to convey is if you think you are having an urgency or emergency, don't wait. Just don't wait.
Yeah, and again, it's not like I've had all these conversations in this week. It's been a lot of different things. A gentleman that I was working at a health fair with one of our sister and partners here in the community and another health organization said to me, he goes, "Oh yeah, I wish I would have paid attention to my stroke conditions. I thought it was really minor, didn't give much thought to it. I had a headache And this is a medical professional within our industry, and he's looking down the list and he says, oh, I had 2 or 3 other things on the B fast. And he chose to drive himself to urgent care. And then, of course, by the time he got to urgent care, then they were like, oh, no, we need to get you to emergency. And then by the time he got to emergency, he had already passed the initial, I don't know if it's hour or whatever that threshold is. And so the medical treatment to him was slightly different of what would be available. And so he now has a lifelong kind of some things that he's working through, which he said, if I would only paid attention to the be fast and went directly to emergency or called 911, I would have not had these issues. And that happens a lot, unfortunately.
Unfortunately, it does. That's why, you know, I'm just kind of preaching to the choir here. You know, it's important. Pay attention.
Yeah. More questions, not just Brett. Come on, let's unmute. Let's get a few questions for Susan.
There's one in the chat.
Yep, I just saw that. Is there any financial connection between Eisenhower and the VA for urgent emergency care performed at Eisenhower?
No.
No, I don't believe so. The VA works they're very independent. And they refer to many specialties here within our valley, and Eisenhower specifically, but they're an independent. So if you're on a VA program and you're with their system, they will ask you to go predominantly through their system first and foremost, unless it's obviously, again, an emergency type scenario. But urgent care, I'm not sure how they work, to be honest. I don't know if we have VA emergency or urgent care systems here in our valley.
We just have the VA clinic as far as I know, but they've been, you know, the dealings that I've had with them in the past, they're fabulous, because again, they want the same thing. They want everybody taken care of. So they've been really good, very helpful.
Yeah, a great question. What info do you need to what info do you need to access my chart if I can't speak?
Again, if you're an Eisenhower patient, the physician can get into your medical records and take a look and look at any past diagnostic studies or older lab work, that kind of thing, and can also any specialists or any primary care physicians, you know, so they know who to reach out to.
Yeah, and I think the other component to that is if you can't speak and you don't have a wallet, or you have no ID, or they have no way to know your name or social security number or address or birth date. I mean, typically, as you know, if you're in the MyChart system, they ask you for your name and they ask you for your birth date. And then they work down the list of credentialing to make sure that we're talking to the right person. So just make sure that you have some type of form, you have something on you that might aid a 911 kind of distress scenario, and then you'll be taken care of.
Yeah, and the same thing, if we don't know who you are and we have no readily accessible way to find out who you are, we're going to treat you anyway.
Yeah.
And we're going to do the best we can with the information we have, and you know, we'll figure out who you are later.
Yeah. Can urgent care perform scans or other than X-ray? Thinking soft tissue injuries.
Okay, so the answer to that is kind of yes and no, because in most of the urgent care medical buildings, we have access to CT, we have this, we have that, but they don't have it in the urgent care proper. So if the urgent care physician, if he doesn't feel this is life or limb threatening, he can say, all right, I'm going to order a CT for you, and we can do it later today in this building, or we can do it first thing tomorrow in this building, that kind of thing. If they feel you need something right away, they'll send you to the emergency department. But like I said, that's not in the urgent care proper.
Thank you. The next question I'll answer slightly, and then Susan might have a better, or Guillermo. The question is, how do paramedics deal with gated communities if the patient is not able to open the gate after hours? I know specifically in my gated community, almost every gate box has an override key, override code. It's automatically programmed in there for paramedics, ambulance, fire.
Yes.
We typically have them coming through, and there's never ever been an issue. Is that your understanding, Susan?
Yes, no, that is exactly it. Law enforcement, paramedics, fire, they basically have the keys to the city. They can get into anything.
Yeah. And if not, they'll use their truck and break down the
There you go.
the gate. I have seen that happen.
Okay,
They will get there to save life. The next question, I know the answer, but I'll leave it to Susan. If I'm an Eisenhower person preferred, and I have a life-threatening condition, but I am closer to Desert Regional in Palm Springs, where should the ambulance take me for treatment?
Okay, so this is kind of a loaded question, but the paramedics are there to save your life. If you want to go to Eisenhower and you live a block from Desert, and in their opinion, you have a life or limb threatening issue, they're going to take you to the nearest place. And that's that. And because again, they're not going to risk something devastating happening, taking you 20 minutes down the road. And I know that's something we all don't want to hear, but again, if it's your life, they're going to take you where they need to take you and take you now.
Yeah, and that happens a lot, and I get that question a lot of different things. And I said the same for myself. I had an accident, and I required an ambulance, and I was here closer to Eisenhower. But in the reverse scenario, I was transported to Eisenhower, and then they felt that I actually needed to be treated at Desert because they're more of a trauma, and the situation warranted a trauma. And so I was equally then transported directly to Desert and got amazing care. So it really is, the professionals on the scene will assess and determine what makes the most sense.
Yep.
There was a question there, Fred, that I think you overlooked from Kevin about, would a mild concussion from head impact be best treated at the urgent care or the emergency room?
Thank you. I did miss that.
Okay, so a mild concussion, and I guess the kind of the question back is, what makes it a mild concussion? And you can, if you bump your head, and no loss of consciousness, you have a goose egg on your head, no headache, no anything, I would say, yeah, you could go to the urgent care, evaluated by a physician, and he or her could decide, I need to send you to the emergency room for further treatment, or maybe I can get a CT scan of your head in an hour and we'll do that. If you fall, basically the trauma criteria is if you fall more than 5 feet, if there's any loss of consciousness, sudden headache, if you're taking any type of blood thinners, that's trauma. That's a 911 call, period, end of story. I'm trying to think of the actress, Liam Neeson's wife. She was on a ski trip, fell, hit her head, no big deal. 3 hours later, she started getting a severe headache, went to called the paramedics, went to the emergency room. They transported her out, and she bled into her head. So was she okay after the fall? Yeah, she knocked her head, bumped her head on the ice. With something like that, you can never be too careful, I don't think. I would, again, in my opinion, I'd rather have you checked out and make sure you're safe.
Absolutely. And it's not related to age. I know we had this come up at an event last night, and Justin Bieber and his wife, and it was one of those things where you would have said, given the age and given the youth, it's like, oh, just I'm a little dizzy, I'm a little this, I'm a little that. It didn't seem life threatening. Only to truly, they thankfully called 911, and only to be realized that there was a serious traumatic trauma going on.
Yep. Again, and then with any of the neurological stroke-like stuff, always remember, be fast.
Yep.
Because timing is everything.
Truly.
Yep.
And when you say that, can you explain the first, I don't know, is it a first hour? Is it how does that work in a sense of a stroke-like condition?
Okay, so when you're suspecting stroke-like, again, as soon as you recognize the symptoms, what's important is what time did these symptoms start? And the reason for that is we can give special medicine called TPA. It's like a clot buster. So if you come in with stroke-like symptoms, the first thing you're going to have within the first 10 minutes is we will already have you in the CT scanner, and we're looking for one of two things. We're looking for a clot or we're looking for bleeding. If we detect a clot, if you're not already on blood thinners, if you haven't had any recent surgery, blood pressure's okay, a couple little criteria, we can give you the special clot busting medicine. And we only have 3.5 hours from the time the symptoms start. And I have seen that stuff work miracles. People who couldn't speak at all, they're halfway through that clot busting medicine, and all of a sudden they start talking, and it's like, how did I even get here? Because they don't even realize what happened. We can reverse in that 3.5 hours, we can reverse any of those symptoms and signs of the stroke. And it's just really important. And then after that medicine is given, then we go and take a look. Why did you develop a clot? What happened? A lot of times we find people who have irregular heart rhythms called atrial fibrillation that they didn't even know they had. And one of the side effects of this irregular heartbeat, atrial fibrillation, some people don't even know they have it. But your heart is beating so irregular that the chambers can't empty and fill properly, and you have a tendency for blood clots to develop, and your heart can just pump it right to your brain. So yeah, that's why timing is so important. Faster time, less permanent damage, and that's what we want. That's our goal.
Fantastic. More questions in the chat or more questions live? Feel free to unmute yourself and ask a question.
If you have AFib, can you not use that medication?
Again, there's very specific criteria. There are different blood thinners, and that we can use Coumadin, Eliquis, all those kinds of stuff. We need to get a very special blood test to see what those levels are. In some cases, we can.
Thank you.
Mm-hmm.
All right. Anyone else? Feel free. All right. Well, give it another sec here. And then we do have our urgent care locations for Eisenhower specifically. We have one in La Quinta on Washington at our Arduous facility. We have one in Palm Springs, Sunrise and, oh wow, just went blank, Sunrise and Tockwitz. And then we have one right here on, what are we on? Gene Osher, just right here. Susan, help me out. Oh, Frank Sinatra. Yeah, our other location. I know I took down your slides. So we have 3 locations for urgent care. I went blank. I pass them every day. And we do have a question. It's like, what about Eliquis? I think that was in regards to probably the blood thinner stroke.
Eliquis is a blood thinner, yes. And what was the question?
Well, I didn't have a question. So I think we
Oh.
were talking about the
The blood
clot
thinners and
thruster,
then
yeah.
using that TPA. Yeah,
Yeah.
like that, we have to do very special blood tests, and we check the levels of the platelets and those kinds of things. So we have to have that information before we go ahead with that blood, clotting buster medicine.
Perfect.
And then I think there was another.
Is there
Yeah.
question?
Is rattlesnake bite is an ER visit question?
Yes, 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 and yes. Actually, rattlesnake bite is 911 call. Some
Okay.
people are allergic to that, so you can get into trouble really, really quickly. If you get envenomated, what happens is where the bite marks are, all of a sudden you'll see the swelling start to move up the limb. So whether it's the leg or the arm, don't suck the poison out. That is a TB thing. You don't want to put a tourniquet on or anything like that. But you do need to get to the emergency room as quickly as possible, because we do start the anti-venom. Yeah, because it's, except for sucking the poison out, it can be very, the envenomation can spread very, very quickly, and you can really get into trouble in a short amount of time.
And that would probably play the same as rattlesnake or a scorpion or specific or certain spiders and that type of thing. I guess kind of begs the question, if you don't know what it is that just bit you necessarily,
Go in and get it checked out, because even though typically we're not supposed to have the brown recluse spiders in this area, I've seen brown recluse spider bites. I have. I've seen people with scorpions. There's all kinds of assorted other little creepy crawlers out there. I once took care of a patient, actually. It was the first one I ever saw, someone who had been bitten by a black widow and actually was allergic to it, and it turned into a real life-threatening emergency in a very short time. So yeah, I don't fool around with any of that kind of stuff.
And then obviously if you're predisposed to any allergies, or if like bees or things, and we have a lot in our season of, if you're out there in our community and enjoying our fabulous weather, you never can tell when that's going to happen. Just make sure you have your EpiPen, or make sure that you have the appropriate things that you know of. And if it's new to you and you don't take any chances. Go immediately and get it sorted out. The last thing you want to do is realize that you do have some kind of life-threatening piece and didn't take action.
Exactly.
All right. Any final questions from anyone in the chat or online or open mic? Guillermo, anything from you?
Not really, besides thank you, Susan and everybody joining us, and make the formal announcement for our next lecture, which is on February 22nd. And it's about stress management. So
yes, it'll be great. And it's the perfect time of year to be thinking about that. As Guillermo said, this is our partnership with the LGBTQ Center, but we also, the same day, on every other Wednesday during the month, we do what we do with our senior centers, and it's just by the fact of we partner with them from 10 to 11 on Wednesday mornings. And then there's different speakers for that. And we're doing a whole thing on cardiovascular as we come up. Our March focus will be on colorectal cancer and anal cancer specifically. That we'll be doing a lot of lectures and some panel discussions coming up with notable speakers and about screenings, about all the things you need to know about protecting yourself and when you least expect it, to make sure you're knowing what to ask your physician.
Yeah, thank you, Susan. Great lecture today. Appreciate it.
Thank you. I
Anything
certainly
further? Yeah.
appreciate it.
Anything last from you, Susan? Are you?
No, just be safe. And again, if you think you need to be seen, do it. Don't wait.
Yeah.
Okay.
And don't let the distance affect you. If you need to go to desert, go to desert. You need to go to JFK, go to JFK. You need to come here. Please don't use that as a defining answer and then limit yourself on the treatment. All right.
Thank you, everyone.
Thank you, everyone. Have
Thank
a
you.
Yep, thank you.
See you soon.